I know that I'm disappointing some of you who came from far away just to listen about vasculitis. And therefore, I decided with my wonderful chairman that at the end of my talk, let's say in about 2 or 3 hours, I will answer a question about vasculitis. So if you will be so kind to prepare the questions, just write them and raise the hand and ask me the question. I will do my best to answer also those questions. If you will be tired in 2 or 3 hours, we'll skip the vasculitis. Okay? So let me start without much ado the story of the adjuvant-induced arthritis, this new syndrome which is called the Appi syndrome. And it is really at the heart of autoimmune diseases. So for you to understand autoimmunity, together with my talk tomorrow, you will really understand why somebody develops autoimmune disease, why he or she develops it in 14th of July, and why one develops lupus and the other one develops, let's say, vasculitis or rheumatoid arthritis. Now, since I will be talking about vaccine, I want to stress, to emphasize, and to express my feeling. I'm not against vaccines. I'm against bad vaccines. And as you will see at the end of my talk, there are some bad vaccines, like the HPV. If they call me, tell them that I'm busy in the talk now. If they call me personally, if not, you don't have to answer. And one of the bad vaccines which we have currently is the papilloma virus, and I know that also in India there are some kind of measurements taken to stop the widespread vaccination. Why it is bad vaccine? Because the companies developed it. They had, I believe, goodwill in developing it. But then when they made the money, they didn't want to stop the vaccine, even though it has been found to cause different side effects and especially autoimmune diseases, as you will see at the end. So as you will see in the 2 aspects that I mentioned, but also in other aspects, but in vaccines, and also in the breast implants, we have to go to personalized medicine. And like with drugs, not everybody is equal. By the way, today we know that women respond differently to different drugs than men. And there are also personalized indication for women, but also people are different because they have different genetic marker. And who better than you that you do studies on genetic of SLE, that you know, first of all, the genetics in Indian is different than the genetics in Caucasian or genetics of Chinese and so forth. So this is one of our latest papers, as you can see, appeared in 2014, about indicating or recommending a personalized medicine also with vaccine. Now, this may be cumbersome, it may be money consuming because you will need to know the background of everybody before you vaccine, and now we vaccinate everybody without asking the question. But I believe that eventually everybody will be born and we'll have a card in which on the card his HLA and maybe even the genome will be recorded. So we will be able eventually in the future to recommend or to avoid in some people some kind of vaccine or some kind of the adjuvant that you will see that they are very important. We are not the only one to refer to personalized medicine. There is another paper in Autoimmunity Review, which incidentally I'm the founder and the editor of this journal, but just on the way to India, I read another paper from Colombia in which they had a lot of problems with HPV, recommending the personalized medicine. So you, the clinical pathologists, may be recruited in the future to do the test and to recommend this personalized medicine. So you need to know who is at risk of developing autoimmune disease, and that's the reason or the main message of my talk. So in the bottom of this question, I would like to ask why we develop autoimmune diseases and who will develop autoimmune diseases. Since you are quite small number here, and I would assume that there are about 30, and I heard that you limited the number to 20, but also in my country, when you limit to 20, it means 30. Tomorrow there will be a larger group, so you will forgive me if 2 or 3 of the slides you will see also tomorrow as a background to my talk. So this relates to a book that I have published in 1988. It was the first book that I published out of 60 in autoimmune diseases, which we named the Mosaic of Autoimmunity, which came to simplify who and how do we develop autoimmune diseases. So to simplify things, I have to say that there are 4 groups of factors which are involved in autoimmune diseases. Neither of them will cause autoimmunity by itself. So you need them to play in concert. What I mean by concert is the mosaic. And by this definition, you understand why one person differs from the other, even though they might be brother and sisters, or father and son, or mother and daughter. So there is no question that all autoimmune diseases are genetics. It didn't happen to me in my life that a patient with any autoimmune disease, you are leaving my talk?
But they say you are not registered for this, you have to go. These guys are not registered, so I have to go.
No. Give him a special permission. Listen, he paid me a lot of money. You don't kick out nobody from this one. No. It's again my democratic feelings. Stay here, you don't have to wait. It's okay. It's me. So in any case, it didn't happen in my life that a patient with an autoimmune disease entered my room being polyangiitis, necrotizing polyangiitis, or rheumatoid arthritis, and I asked him, anybody in your family had autoimmune disease of the thyroid? Because not everybody knows what the thyroid. And never ever I got a negative answer. Always it was positive. Myself, my mother, my father, my sister, my daughter, and so forth. So why do I ask about thyroid? Because thyroid is the most frequent and common autoimmune disease in the world, about 2% of the population. So for me, it's one of the markers for autoimmune disease. And you as lab pathologist or clinical pathologist, most probably you have noticed that in many different autoimmune diseases you can find anti-thyroglobulin antibodies and anti-thyroid peroxidase, anti-TPO. And not necessarily it means that the patient has thyroid autoimmune disease, but they carry these autoantibodies with them. So as you will see, for us, the genetic markers may be HLA, and I will refer to it, but also the genes themselves. And today with the genome, deciphering the genome, as I mentioned at the start of my talk, everybody will have his card with the genes, and he will be able to know what kind of risk he might be imposed in the future. There is no question that you need some kind of defect in the immune system to redirect the immune system against yourself rather than against the foreign invaders like viruses, bacteria, government employment, parasites, and so forth. So in any case, the defects are very common. I will not go over the defect, just to mention one which is very, very common. IgA deficiency, you can find it in 1 out of 600 healthy subjects. What does it mean, healthy subject? They are completely healthy, but they are more prone to develop recurrent infections like otitis media or a pharyngeal infection. They have more allergies, and they are more prone to develop autoimmune disease. And there is explanation for that. But there are other defects like complement deficiencies. C1q, for instance, was found in the literature in, let's say, less than 100 or 150 people. All of them already developed lupus erythematosus. So it shows you the close connection between the complement deficiencies. Hormonal, we will talk a little bit today, a little bit tomorrow, about the fact that women develop more autoimmune disease. Primary biliary cirrhosis, a liver condition, is 20 times more affecting women than men. Thyroid disease, 10 times more than men. Lupus, 10 times in women more than men. But there is something in women which make them more prone to develop autoimmune disease, and I will explain and tell you why women are more prone to develop autoimmune disease. But there is no question that the fourth group of factors are the most important because they are the trigger mechanism, and they will determine when you will develop the disease, which disease you will develop, and even what kind of clinical manifestation. If we talk about infection, which are very common, EB virus, as you will see, is responsible for more than 33 different autoimmune diseases that we know. I'm not talking about the diseases that we don't know. And drugs, we physicians are responsible for many autoimmune diseases, which are called drug-induced lupus, drug-induced myasthenia gravis, and so forth. And as you will see tomorrow, today I will not talk about smoking, which emerged as a very important factor in autoimmune diseases. So I hope that you will understand, you will remember all these diagram, which came out from a paper that we have published indicating or claiming that we can predict who will develop autoimmune disease. When I say we, it means you, the clinical pathologist. If you will absorb, and if you will read this paper, our paper about prediction of autoimmune diseases, you will know what you have to look for in subjects that are afraid that they will develop autoimmune disease, that you suspect that they will develop autoimmune disease. And therefore, eventually, if you take all these parameters together, you can come to somebody and say, listen, in 4 years, you will develop polyangiitis or polyarteritis nodosa, and it will be represented by aneurysm and so forth and so forth. So I know that it's too detailed, and I'm not going to go through it because my talk is not to predict, even though I will touch this subject a little bit. But you can see many of the aspects that may be associated with prediction. This was an old paper about 5 or 6 or maybe 10 years ago. We today are even more clever and can predict even better who will develop autoimmune. Just to give you an example, if somebody comes to you as a clinical pathologist and you detect in his blood anti-CCP, make with the head like that you understand me, and a rheumatoid factor, did you hear about it? Yeah, you do. Together, combined together, and he's absolutely healthy and asymptomatic, there is 100% positive predictive value that he will develop rheumatoid arthritis in 4 years. So, when I see somebody coming to me with rheumatoid factor that was incidentally found by the general physician or somebody, and he asked me, will I develop autoimmune? I said, no, I don't know. Let's carry the anti-CCP. And if the anti-CCP is positive and the rheumatoid factor is positive, I said, wow, now you are at a great risk. In 4 years, so go to Hawaii, write a nice will, and then in 4 years we will start to treat you. It has a lot of implications on the physician when to start the disease, because today we start with all the monoclonals and the expensive, and the patient is very sick, and when he doesn't respond to the regular therapies. And then we say, let's go earlier. The earlier disease, then we will treat to avoid the complication. Maybe in the future, we will treat the patient when we will be sure the PPV, the predictive positive value, will be 100% before we develop the disease. What is better to avoid the disease rather than to treat the disease? You will have many implications because you will need a therapy which has almost no side effects, because you are not going to give to apparently healthy subject for 4 years a drug to prevent the disease if it has side effects, because the side effects may be even greater. And one of those drugs, so to speak, which we already recommend is vitamin D, because we know that vitamin D has almost no side effect. It's very cheap. You don't need a prescription of a physician. And it has a potential to prevent autoimmune disease. And therefore, I take vitamin D every day, 2,000 units. And even Billy used to take it. Really? My dog. Unfortunately, he died 2 weeks ago, which was a great loss to all the rheumatologists in the world, but we have Lali instead of Billy, and she started to take now 2,000 units of vitamin D. What do I mean by that? That vitamin D is very easy for me to prescribe because it has almost no side effect. So that's regarding the prediction of autoimmune disease. So we do have some markers, as you will see. And for instance, this haplotype, which is A1B8DR3, indicates that you are at a 10-time higher risk of developing autoimmune disease. So you didn't notice, but in the big diagram that I showed you before, this haplotype was implemented inside. So you already can mark it down, but as you will see, there are already papers which list, and we will have additional papers very soon, to list all those HLA haplotypes which make you more prone to develop autoimmune disease. But I would like to concentrate today on the HLA-DRB1 because I came across this HLA, and I'm not an expert on HLA. I believe that there are some pathologists here who are really expert on this field. But the HLA-DRB1 popped up in every disease and every mechanism that I was involved in autoimmunity, and therefore we concentrate today on HLA-DRB1, and you can see here that even in African American it is associated with rheumatoid arthritis. But Maria Arango, that you will hear her name, she's from Colombia, she's doing her postdoc in our Center of Autoimmune Disease. We have a big center of autoimmune disease. She delineated this table, actually it's one of 3 tables, to indicate what kind of diseases are associated with some kind of alleles of HLA-DRB1. And you can see that there are many. There is another 2 tables like that which will appear in our paper to indicate that these alleles are extremely important and most probably should be as a list in your armamentarium as clinical pathologists to indicate if somebody is more prone or not prone. Just to show you that sometimes some alleles are associated with immediately 2 or 3 autoimmune diseases. For instance, this allele O4O2 is associated with type 1 diabetes and rheumatoid arthritis. This allele with SLE, systemic sclerosis and type 1 diabetes, and this one with autoimmune hemolytic anemia and so forth. So you already can understand what I said, which was quite presumptuous in the beginning, that we can indicate exactly what kind of disease you will develop eventually. So we are not in the dark anymore as we were in the past. And as you know, this might explain you why in the same family, the father may have rheumatoid arthritis, the mother may have lupus, and the son suddenly will develop type 1 diabetes, or let's say pemphigus vulgaris, which is a classical skin autoimmune disease. Because the son and the daughter, they have different contribution from the father and the mother, which makes a different allele and will determine eventually what kind of autoimmune diseases you may develop. So why these people which HLA-DRB1 or A1B8DR3 are more prone to develop autoimmune disease. So to understand it, you assume that the HLA-DRB1 represent antigens better, stronger to the immune system to behave stronger, right? So that's the assumption that we may believe. And that's what we believe. And indeed, the HLA-DRB1, they have a special structure that they present it very nicely to the immune system. So, I was not surprised when this paper came out recently in an unknown journal called Nature Genetic, which showed that people with HLA-DRB1 and this allele can resist better enteric bacteria, like typhoid, salmonella, and so forth. So you can understand that these people had advantage in evolution because they could find better the bacteria, but at the same time, they have disadvantage because if the machine goes astray, they will be attacked or they will develop autoimmune disease. So this is this HLA-DRB1. So it's not surprising that we should personalize our attitude toward vaccine, toward other things, and it was done in different other aspects of giving drugs. For instance, this drug, abacavir, which is a very important drug, as you can see, it is given or avoided in some people with some HLA because they are the one who will react with side effects. So we can be more sophisticated in the future to understand things. And here you can see that patients with this HLA-DRB1, again we're coming to the HLA-DRB1 haplotype, they are the one who may develop lupus after hepatitis B virus. So it's important to give the hepatitis B virus because hepatitis B virus may be associated with at least 8 or 9 autoimmune diseases. So we avoid autoimmune, but at the same time, if the subject, the individual, have or has this specific HLA, you will develop lupus, so we don't want it. I mean, we are physicians and we would like to treat the patients properly. So now we come to the big question, why women develop more autoimmune disease than men? Because women are the strong gender. I don't see any smile. I don't see, here I see a smile. Because, you know, the male, the macho man, they think they are strong, etc. But it has been found that the immune system of the women is much better than the immune system of the men. You can ask me, how do you know that? If you take the lymphocytes of a woman and you put salmonella, it will jump on the salmonella. If you take your lymphocyte, and don't be insulted, it's not personalized medicine, take your lymphocyte, they will move slowly toward the salmonella. But incidentally, if I will take from her the estrogen, and I will drop it on your lymphocyte, poof, they will jump on the salmonella. So why the women have a better immune system? There are many explanations. One of them because God is male, and he loves more women than men. But God believes that females are more important for our evolution. As my wife always said, what did you contribute to the evolution? Nothing. A small switchy. I was the incubator. So that's the reason why the women needs a better immune system. And if you know, and I believe that in India it's the same, after the husband died, the women can marry at least twice because she lives longer than the men, and that's one of the reasons, because she has a better immune system. So one of the things that has been found in women was that they secrete a special cytokine called B lymphocyte stimulating hormone, BLyS, or BAF, also it's called BAF. And this lymphocyte was found to be important in lupus, and therefore the first biological therapy in lupus is anti-BLyS. So now we understand why women are more prone to develop lupus than men, or the same with thyroid autoimmune disease. Moreover, you can see here a woman with common cold. She makes a cup of coffee and that's all, she goes to work. But you see a man with a common cold, he doesn't go to work, he wants the cup of coffee to be brought to his table, etc. So it has been found that actually lymphocytes, our peripheral lymphocytes, they have receptors to androgen and estrogen, as you can see here, and therefore the estrogens of the women actually stimulate the lymphocyte to react stronger against foreign invaders, viruses, bacteria, parasites, etc. But at the same time, when there is some kind of a defect in the complex, it also will attack your own tissue. So now you will understand why adjuvants are so important in induction of autoimmune disease. Adjuvant, or the word adjuvant, comes from the Latin word adjuvare, to help. So what the adjuvants are doing, they help the immune system to react more strongly. So now you understand, if you have a woman, or you have a man with HLA-DRB1 with a special allele, and you expose them to the adjuvant, poof, the flame will start and they will develop the autoimmune disease. So unfortunately, we have adjuvants all over the world and all over around or surrounding us. And there is no question that many of the infectious agents contain adjuvants. And therefore, the way how different infectious agents cause or induce autoimmune disease is by being adjuvant. To give you an example, those who work in the lab will raise their hands. Those who work in the lab, raise your hands. Did you hear about incomplete and complete formed adjuvant in your life?
Yes.
Say yes with you, but say it loudly. I hear only women here because they are the strong gender. Do you know what the complete formed adjuvant, which we use to immunize mice and rats, etc., is composed of? Dead mycobacteria. Dead mycobacteria, you are right. Dead mycobacteria. So we are taking advantage of the fact that infectious agents have adjuvants to induce what we want in the lab. Actually, we induce autoimmune diseases in the lab by using the complete adjuvant. If you take thyroglobulin and you inject to mice, they will develop antithyroglobulin, but they will not develop thyroiditis. But if you will take the thyroglobulin with an adjuvant and you will inject it, you will get thyroiditis. This was the first model of experimental autoimmune disease in the world, produced by Noel Roche, who is still alive. It was in 1956. He's regarded as the father of modern autoimmune disease. He's still playing tennis and he's still beating me in tennis because I'm a very bad player. But it means also that in his elderly age, he still is very physically fit. He described this experiment in which you give the adjuvant with the autoantigen and you can induce the disease. But as I mentioned before, and I will discuss today the silicone, and you can understand that vaccine contain adjuvant because these not all of them, by the way. And the most prevalent adjuvant is aluminum. Aluminum. Why do you nod with your head like that? You should say, oh, oh, oh. Aluminum is a terrible element which is responsible most probably for many, many of our autoimmune disease. So you would immediately ask me why the companies are still using aluminum in all these vaccines. Because it's very cheap, it's very, very effective, and they don't want to replace it because it will cost them a lot of money. So they are not interested until we, the physician, will raise our voice, and that's what we are doing, but still we are a little bit silent in what we would like to do. But let me just give you an example. When I was very young and very beautiful, and used to be a physician in the clinic, in the department, we received patients for dialysis who had a renal failure, actually complete renal failure. We sent them for dialysis and we admitted them back, many of them with encephalomyelitis, or what we called dialysis dementia. And we didn't know why. We sent them with chronic renal failure. Suddenly something happened to the brain. And it has been found that this was the aluminum in the dialysis. When they have taken out the aluminum from the dialysis, we don't see it. The young physician will never see anymore, I hope, dialysis dementia as we have seen. So this is, by the way, Noel Roche. As you can see, this is me when I was a little bit younger and a little bit more beautiful. And you can, this is the story that I told you, how he injected thyroglobulin, but when he injected with complete formed adjuvant, he got the disease itself, the thyroiditis. So what are the adjuvants? How they cause the autoimmune disease? This is a diagram which was published in Nature also, and there are different spots where the aluminum or the adjuvant can react. You can see that some of the adjuvant react on the innate immune system, on the toll-like receptor. Some of them are presenting better the antigen for a longer time. That's what we want in the immune system. Some of them present it better to the MHC. Some of them work on the inflammasome, which is intracytoplasmic, and cause a secretion of many of the inflammatory cytokines. So as you can see, the adjuvants, by and large, they enhance the uptake presented for a longer time, stimulate the cells, and therefore they are so effective in inducing autoimmune disease. And one of the things that these adjuvants can do is by inducing, you will be surprised, uric acid. And uric acid, which you know from other aspects, is one of the best inflammatory substance in nature that stimulate the immune system. So I will go now to the story. So after many years of working with side effects of vaccines, side effects of silicone implants, we have decided to report on the syndrome. Syndrome is not a disease. Syndrome is a complex of clinical manifestations. It was published in Journal of Autoimmunity in 2011. There are many, many papers relating to the Asia syndrome, autoimmune inflammatory syndrome induced by adjuvant, and to describe what the subject developed following the being exposed to the silicone implants or to the vaccine with aluminum or to the aluminum elsewhere. And tomorrow you will hear about a notorious substance which appears in plastic. You're still drinking from this plastic bottle? Okay. But you have a good HLA, so you will not develop the autoimmune disease. So you can see that many of the patients develop fatigue. But this is not fatigue that you say, oh, I'm tired today. It's fatigue that the people tell me, when I wake up in the morning, I'm sucked back into the bed. And they have cognitive impairment, they have memory impairment, and as you can see, they may develop different autoimmune aspects, from arthralgia, which means joint pains, to even arthritis, to myalgia, which are muscle pains. And then in due time, they may develop a specific autoimmune disease, vasculitis, lupus, or so forth. And therefore, sometimes the incubation time is longer. But we know today that the incubation time of autoimmune disease may be 10 years, 15 years, since you are exposed to the trigger mechanism. There was a paper in another unknown journal called New England Journal of Medicine, which they have retrieved a sera of patients that eventually developed lupus, but they were soldiers in the American Army. So in the repository, they had samples of their sera before, when they were recruited to the army, sometimes 10 years ago, sometimes 20 years ago, and they detected anti-DNA, anti-SM, anti-RNP, anti-RO, anti-LA. Am I talking to people who understand what I say? Not with your hand, I like the nodding. So in any case, eventually, they found that sometimes the incubation time for lupus was 10 years. So we know it now. And therefore, when all these screenings are done after vaccine, and they cannot find any autoimmune disease or increase in the prevalence of autoimmune disease after 1 month or 2 months or 3 months, it doesn't say anything. First of all, they are not looking for Asia, for tiredness, fatigue, chronic fatigue syndrome, which most probably in part is induced by vaccines too, etc. And second, they do not follow up the patient for a longer time. So you can see the Asia syndrome is a complex of clinical manifestations. One of the major manifestations is chronic fatigue. The incubation time may be 3 weeks, but sometimes may be years. It's chronic stimulation of the immune system. By the way, they have taken mice and they vaccinated them again and again. Actually, they gave them adjuvant again and again. These mice developed the Asia syndrome. So just the chronic stimulation, and I would like to remind you that even in India, the children, they get close to 30 different vaccines in a short period of time. And as I mentioned before, I'm not against vaccine, but I'm raising the question, should we dispace the vaccine, not to give them all together, one after the other? Shall we wait sometimes and give the vaccine when the brain is fully developed and not when they are so young? So you can ask me, why do they give the vaccine at a very early stage? because this is the time to catch them. So it's only a practical point of view, not a medical point of view that they are doing. So just to go to some of the studies, and I will not delineate too many, I would like to give you an example of a disease which is called narcolepsy. Look at me, what is narcolepsy?
Daytime sleeping.
Wait a minute. And I continue to listen. So it's attacks of sleep. And it was very interesting, this disease. You can see here a case of narcolepsy, not necessarily just picture that I've taken in different conditions, as you can see in the aeroplane. This is outside the aeroplane, and this is father and mother who are tired from their child, and so forth. So narcolepsy is a very interesting disease because it's strictly genetically determined. What kind of HLA? HLA DRB10206. And then, as you remember, we had the flu, the H1N1 vaccine, I would say plague, and everybody in the world was vaccinated against it, etc. And then suddenly, in one country, which is in Denmark, which has about 5 to 6 million people, and therefore they marry in between themselves, and as you can understand, sorry, Finland, not Denmark, and therefore they actually enriched the HLA-DRB1 among the population. And they found that following the vaccine, there was an avalanche of cases of narcolepsy, like 14 or 16 times the regular report. Now, we have known already that this disease is strictly associated with HLA, like many of the autoimmune diseases. We have noticed that it is induced by infection and by vaccine. So it reminds us the classical way how autoimmune diseases are induced. And as you know, my slogan all over the world is that everything is autoimmune until proven otherwise. So it raised the possibility that the narcolepsy, attacks of sleep, are an autoimmune disease. It's like I will tell you that depression or schizophrenia is an autoimmune disease. Are they? Sure they are. But that's not the story for this time, it's for the next year when I will come again. So in any case, if you suspect a great idea and still you didn't find it, go to the literature and find if Japanese didn't publish it before. And sure enough, the Japanese published it before. And we have found at least 2 papers in which a Japanese group reported on the presence of antibodies to granules in the brain, in the hypothalamus, which contains a substance called orexin. This orexin is like the insulin type 1 diabetes mellitus. So the orexin is responsible for our being awakened or asleep. And indeed, in patients with narcolepsy, they have lower level of orexin in their blood when they are sick. So they found that there are antibodies against the granules which contain the orexin, and they cause apoptosis, and therefore you have no orexin. Does it remind you type 1 diabetes mellitus, in which you have antibodies against the beta cells, which contain the insulin, destroy the beta cell, you don't have insulin, you develop type 1 diabetes mellitus. And so, sure enough, we send an email to our Japanese colleagues, and we ask them to send us the sera which are positive with these antibodies. And this is Maria Arango. She exposed it to the brain of mice and showed that indeed this antibody can cause actually the apoptosis of these cells or granules which contain the orexin. But moreover, as you can see, what she did, she injected these antibodies directly to the brain of collaborative mice in our laboratory. Now, as you can see, we treat our mice very fairly and in a very ethical way. You can see we don't want them to be exposed to their peers, and I'm afraid that in the next year we will have to ask each one of the mice to sign informed consent before they participate in the experiment. And when Maria injected it directly to the brain, we wanted to know if the mice are still dancing or if they fall asleep. I will not show you this film because it will take more time, but this mouse was filmed through the night because mice are active in the nights. So we didn't want Maria to get narcolepsy, so we built a camera, a photo camera, which actually filmed the mice. And these mice, you can see them, they trim themselves, they are happy, they think, they dance, etc. And suddenly have the attack. And then they wake up and continue to trim themselves. So she could count by the camera, it's computerized camera, how many times, and there were many attacks by injecting this antibody. What we did here was the ultimate evidence that a disease has an autoimmune properties or mechanism or background. We have taken the antibody or the autoantibody from the human being, we transferred it to the brain of the mouse to overcome the blood-brain barrier, and the mice developed the disease, the attacks of narcolepsy. So what you can see here, this was a disease, a classical autoimmune disease, which was induced by vaccine, is an adjuvant, and the subject developed a classical autoimmune disease. Do we have other evidence that vaccine can cause autoimmune disease? Yes, we have. This is Westin Reeves. He's a marathon runner, as you can see here, and he's a professor. And all his professorships is due to adjuvant-induced autoimmune disease. And you can see that these adjuvants, when they injected to mice, can induce anti-SM, the highly specific autoantibodies in SLE, anti-RNP, anti-ribosomal, and so forth. And when he continued with that, he was able to show that they developed autoimmune disease. But one of the most interesting stories in the autoimmunity history is the salmon fish. Now, as you know, the salmon fish is very tasty, it's very healthy, and it's healthy and most probably also tasty because the fish swim against the stream and they lay their eggs somewhere at the beginning of the stream. No more, as they say, no more war, no more bloodshed. So what they do, they grow them in ponds. And in the ponds, they are weaker, like men, not like women. And therefore, they get infection. And therefore, the farmers, as you can see, immunize or vaccinate each one of the salmon and throw them back to the pond. So it was wonderful to check these salmon, because there are many salmon, to see what happened to those who were vaccinated in comparison to those who were non-vaccinated. You can see they differentiated them into different groups, and the big surprise. Only those who were vaccinated, as you can see, developed anti-double-stranded DNA, anti-thyroglobulin, anti-beta-2 GPI, the specific autoantibody for APS, and also other, as you can see. When they followed these salmon, they showed that these salmon developed those who had anti-beta-2 thromboembolic phenomena, as you can see here. And moreover, some of them developed, as you can see, glomerulonephritis, like in systemic lupus erythematosus. And even when they x-ray the salmon, who x-ray salmon? Crazy researcher, they showed that they developed a panus, which is a tissue in rheumatoid arthritis, which is so classical for rheumatoid arthritis. So my dear friend in Italy, Andrea Doria, and some of his students, they went to NZBW mice. These mice developed genetically lupus. Actually, when this was found, was the first time to show that actually all autoimmune diseases are genetic. Because the NZB, the black, New Zealand black, they don't develop lupus. The NZW, the New Zealand white, do not develop it. Only when they made them together, they develop the F1 offspring, they develop the lupus, just to indicate that all autoimmune diseases are genetic. And when they injected to these mice NZBW adjuvant, you can see that they developed higher titers of anti-double-stranded DNA, they had more severe earlier glomerulonephritis, they develop actually myocarditis, and they live shorter in comparison to the non-injected mice. Now coming to the end of this presentation, because I don't want to fill you too much with this idea, I mentioned at the beginning of my talk about the papilloma virus, which I don't think is a necessary vaccine. It has not been shown to be effective because it will take 20 years if we will see that there is a real reduction in papilloma virus-induced carcinoma of the cervix, but it has many, many, many side effects. So we were not lazy enough, and we have injected both HBV, which contain aluminum, as you can see, to SLE mice, and you can see that the HBV had different effects on the different neurological manifestation. Mice had to find out the food on the right side or the left side. If you inject this alum from the HBV or the vaccine itself, they have defect, they cannot find the place, cognitive impairment. You can see that in the swimming test, we are doing less than the control injected mice. And when you take their brain, you can see that there is increase in the number of microglia. This is the immune reaction of the brain. So in another study, we have injected actually HPV, the papilloma virus, and the results were amazing. They were the same as HBV vaccine, as you can see in the swimming test and the rest of all. Interestingly enough, in Spain, the sheep that are grown by the farmer, they are also more prone to develop different infections, and therefore they are highly vaccinating these sheep, and see what happened. They develop also, they develop also the Asia syndrome, the chronic fatigue, the emaciation of the body, and when you analyze the brain, you can see the infiltration of the lymphocyte into the brain. What else do we need to show that indeed an adjuvant can cause autoimmune disease in human beings? So in a paper that we have published, we have taken a large number of subjects who had re-challenge. It means that they got the first injection or the first vaccine, and then developed some symptoms, and then they re-challenged him. They gave him the boost vaccine, and you can see that all of them developed the disease in a stronger way on the re-challenge, as you can see. So what are the mechanisms? The main mechanism is actually the adjuvant, and I summarize to you that it exposes better the antigen to the immune system, it activates the toll-like receptor and also the inflammasome, but also the vaccine may contain infectious agent, reagent with molecular mimicry to our body, like rheumatic fever, and also some preservatives. So this is the HPV that I know that there were many reports also from here, from India. And these are two of our reports, one in which the HPV induced lupus. This is a group of people, including Navarra from Indonesia. And this is a very interesting observation that young girls who are getting the HPV, they develop primary ovarian failure. It means that they will never be able to be pregnant again. It's terrible. I mean, she got the HPV, and then she cannot become pregnant anymore. So this is the different manifestation in the brain that I mentioned to you before. I will not go over it so much. And last but not least, many of those who get this HPV vaccine and develop the chronic fatigue syndrome, it has been found that they have what we call postural tachycardia. When they try to stand up from a recumbent position, then they are dizzy, they are weak, and they cannot adjust themselves to the erect position. And it has been found that it is autoantibodies against the autonomic nervous system, which try to balance our way. I will skip these slides to explain you. And I will just finish with the fact that all over the world there are movements against the HPV. They are still not strong enough, but eventually they will be quite strong. This is in Japan, in which they cancel the public support for the vaccine. And this is just our recent book that was published last week about vaccine and autoimmunity. And those who will attend the Congress of Autoimmunity in Germany, which will be the 10th International Congress of Autoimmunity, will get this book free of charge. So we are going toward personalized medicine. I show you the paper before. Now I would like, I will finish by saying thank you for your wonderful attention. So now, despite the fact that this is a plastic bottle, I will drink some water because I'm so thirsty, and that's what happened to all. You can ask me a question about the Asia syndrome, and then, with your permission, if there will be question about vasculitis, I will answer about the question of vasculitis. Let's start with the second question. Second question. Second question. Yes, you want to ask? Yes.
I want to ask, like, orexin, you told that granules in the hypothalamus. So this is related to, like, you find it in depression and schizophrenia also?
No.
I think you told that cause apoptosis and...
Yes. But the story with depression, because I mentioned that depression may be an autoimmune disease, so I will explain what the difference between depression as an autoimmune disease and narcolepsy. All of you know the disease lupus. In lupus, we have published a paper about volcano appearance of autoantibodies. We have 180 different autoantibodies in lupus. This may explain why we have such a panoply of manifestation in lupus, from the kidneys to the brain, from the skin to the cells, etc. One of the autoantibodies that most probably work with it in your lab is called anti-P ribosomal. Anti-P ribosomal appears between 10 to 20% of patients with SLE. It's highly specific. It doesn't appear in other autoimmune diseases. And in New England Journal of Medicine, in 1987, it has been found to associate with psychiatric manifestation. And it was debated during the years whether it's true, because this alludes to the idea that psychiatric manifestation can be an autoimmune. Now, that's for sure. Because when you have psychosis in lupus, how do you treat the psychosis? You don't give antipsychotic drug, you give steroids. And the psychosis disappear, evaporate. So this already had to ring the bell that also some psychotic attacks or schizophrenia or depression may be autoimmune in nature. So we have isolated the anti-P ribosomal from patients with depression and lupus. We injected it to the mice, and mice develop depression. How do you measure depression in mice? You put them in the swimming bucket, and instead of swimming, they float. So this antibody was found to bind to the limbic system in the brain, not to the hippocampus, to the limbic system. The limbic system is associated with smell. And that's the reason why in depression you suffer from loss of smell. And that's the reason why you don't eat when you are depressed. And that's the reason why women with depression, they splash on themselves a lot of perfume, so they don't smell. And when they get out of the depression, they say, "Phew, how do I smell?" And they stop splashing on themselves. That's a very important advice to the men. If you date a woman and she smells from a perfume too much, be careful, she might be depressed. You understand? So, as you can see, we have different autoantibodies, and they bind to different areas in the brain, and therefore they can cause different clinical manifestations. This is similar also to vasculitis, in which you can have anti-endothelial cell against large vessels, and you will have large vessel vasculitis, and you can have autoantibody against small vessel, and you will have a small vessel vasculitis. Did I answer your question?
Yeah, but that leads to my second question, like.
Wonderful, I paid you to ask a question. Well done. We are a good team. Yeah.
The second one is like, narcolepsy, the Finland study you mentioned. So they found that H1N1 vaccine caused the narcolepsy.
Yes.
So what is the treatment, like maybe a little bit?
You mean the treatment
Yeah.
eventually? Okay.
Like, they find out that narcolepsy caused by the H1N1 vaccine.
Among other things
Yeah.
in that attack.
Thinking about in the
Right.
autoimmunity.
By the
terms.
way, in China, the narcolepsy is induced by virus. So the question was,
Or anything like narcolepsy or like
Yes, yes.
depression, behavioral, any issues.
don't be my wife. My wife do not always stop me in my words. So let me talk. So that's the reason why I come to India. Here I'm a free man, I guess. So the question was how to treat the patients who already developed narcolepsy, namely the autoantibody bound to the tribal cells which contain the orexin and cause apoptosis. I'm going to challenge you. How do you treat patients with type 1 diabetes mellitus? It's a question you have to answer.
Insulin.
Do you know? Okay, so you cannot reconstruct because the beta cells were apoptosed by the autoantibody. So you can give a replacement. You can give the insulin, correct? Today, there are already preliminary reports that you can implant a new pancreatic tissue, okay? In the brain, it's different. You cannot inject into the brain the orexin, so you do not know what to do. In the brain, it's different. Still, they didn't plant brains, because it will be more complex than other tissue. So there are different drugs which are supposed to substitute the orexin, and that's what they are given to the patient. It's not only in Finland, it's all over the world with narcolepsy, and there are quite a number of patients with narcolepsy. Third question. Thank you very much for your question. You are a wonderful lady.
The causes of
Yes, please.
The cause of dementia and chronic renal failure (ESRD) is more of an amyloid rather than
No.
because
Don't continue because you are mistaking the people. There is difference between chronic renal failure dementia and dementia which appeared after dialysis.
Okay.
The chronic renal failure dementia in which after many years you develop,
yes.
you may develop dementia, may be associated with amyloid deposition, so it's like an early Alzheimer. By the way, there are many papers, especially from Chris Exley from England, who is an expert on aluminium, showing that Alzheimer is also associated with our exposure to aluminium, just to make the common denominator. In the chronic renal failure, dialysis dementia, it was an acute stage. The patient has returned from the dialysis shunt.